Service, like many around the world, has been called upon to respond in new and different ways to our global pandemic of COVID-19. Here to tell us more about that response is Matt Fox, Senior Technical Strategist at Microsoft UK, and Laura Robinson, Senior Director of Health and Life Sciences at Microsoft UK. So welcome, Matt and Laura.
Great. Good to be here. Thanks for having us.
Good morning.
Morning. So can you tell us a little bit more about those titles and what it is you both do at Microsoft?
Sure. So as I was introduced, my name is Laura Robinson, and I head up the Health and Life Sciences business here at Microsoft in the UK, which means we work with the government body known as the Department of Health, alongside the trusts that help deliver care. And ultimately, our goal is to help them take advantage of what technology can do so that they can deliver better patient care. We can create some efficiencies, save some money, and help them leverage the power of their data. Matt?
Thank you. Yes, I'm Matt Fox. So I lead the technology relationship that we have between Microsoft and the Department of Health and Social Care, which in simple terms means that I care about their overall strategy and what they want to achieve with Microsoft technology and how we can help them achieve their objectives. In the context of the COVID-19 response, I've been working with a fairly large team over the last 8 weeks or so, who've been responding to many of the immediate architectural challenges that the NHS faced around resilience and scale, for example, and also the creation of new cloud-based assets.
Fantastic. And so, let's dive straight in. What has been happening in that space? What have you been working on? I believe there's multiple projects that you guys have been very busy with.
Yeah. So it's actually been a really interesting and busy time, I must say. We've had quite a few engagements that have come in over a fairly short period of time. So it's been keeping us pretty busy. But I'd say there's really 4 areas that we've been working alongside the NHS to help them during the crisis. And the first is within their existing infrastructure and resources. So knowing that there would be a lot of demand for insight and information, they had to shore up their existing infrastructure for things like NHS 111 or the NHS app. So we work closely with them to bolster that so that they could scale, while the traditional channels were probably either decommissioned or used for other purposes. They also had some needs for new infrastructure. So as you can imagine, they had some existing data sets. They had new data sets. They had to bring them together to better understand the state of the crisis. And then bringing that data store, they also had to create some dashboards to both inform the internal audience, but also to inform the public. So leveraging the resources, we created some dashboards with Public Health England to make sure that the KPIs and the status of the crisis were well shared and communicated. There was also a need to set up some emergency pop-up hospitals, if you will, in record speed. So we collaborated with the Ministry of Defence to help support the communication structure of Gold Command using SharePoint. That not only enabled them to communicate within the London hospital, for example, but then also to the regional hospitals as they came on board. And then I'd say finally, we worked with them to understand how to keep the healthcare system doing business as usual during a pandemic, which is no small feat, I assure you. But they had to think about things like remote working, how to do virtual consultations, how to ensure secure chat and communications amongst non-clinical resources who were working from home. So we supported them through deploying Teams, our Teams platform, to 1.3 million NHS employees over a 4-day period. So we've been kept very busy, but I must say, I'd say we've been more humbled and honored to work with our frontline workers at a time like this.
I was going to say, it's fantastic to hear the combination of both Microsoft and our customers like the NHS and how we can all work together to make sure that people have exactly what they need.
Mm-hmm. Yeah, I agree. You've obviously been very busy and there's been so much going on. Matt, I'd like to kind of pick your brains a little bit about some of we'd love to talk about all of those things, but unfortunately we don't have the time or the luxury to do that here on the live show. So you mentioned, or Laura mentioned, the Public Health England dashboards that you worked on. Can you tell us a little bit more about that? I think that's a service that a lot of us have probably all used.
It is. So the work we've done with Public Health England has resulted in the .gov.uk public dashboards. So these are the ones which show the daily figures across the UK of COVID-related illnesses and deaths at a regional level and at a national level. And so that's been a collaboration across a number of different government agencies to get the data into our cloud service, Azure, and also then publish those dashboards in a really highly scalable way. And actually, they were moved from an on-premises architecture. We needed to do some pre-production testing, which we did, and hit in the region of 360,000 requests per second onto the website. And we were also then faced with a key point in time where UK government announced that they would begin to include the care home data in those reported figures. And as you can imagine, that sparked quite a lot of interest, and we saw a threefold increase in traffic to that website across a 24-hour period. And the architecture didn't even blink. So we felt pretty good about what we built there in terms of the scale and the resilience of what needed to be delivered.
I love that. And you've done that in we'll talk about the technology in a minute. A man after my own heart. I can't wait to dive into that. But the just how do you go about doing that, Matt, in such a short period of time?
From an architectural point of view, the back end is actually pretty simple. That's probably the beauty of of what's been built, and given the situation, the speed with which we were able to respond was quite handy. I guess there's just three component parts if we sort of dig into the architecture a little bit. If you just want to access the website data, there's an Azure App Service in the back end. That's obviously a fully managed platform, so there's no need for any virtual machines to be running. And then we have some blob storage, which contains the data sets which are used to power the dashboards, and that's Public Health England data. It's refreshed on a twice daily basis. And we're actually in the process of moving that to Cosmos DB so that we can provide a query API across that data. It comes in from a source, and we just use an Azure function to run a process which just generates the files. And then we have some logic apps running in the background to feed the development and staging environments. Sat across the front of that, we have some standard Azure content delivery network services, which gives us some point of presence and global caching and so forth. So it's a pretty simple architecture, actually, Dean, in the back end. We've provided with people the ability to download the public data sets as a CSV or JSON file. So we see a lot of people who we don't know, but they're creating their own dashboards and extracting that data on a daily basis, so that we're able to provide that data to whomever in the world who is doing similar kinds of things.
Nice. That's a lot of that's music to my ears. I love so many things about that. One, a bunch of services you mentioned there, I would categorize into the serverless bucket, which is a passion of mine. I absolutely love serverless, so I'm excited to see that. And also really the fact that you mentioned the simplicity of it, not overcomplicating things and making it as simple as possible has probably helped you move a lot faster, I'd imagine, as well. And also, I just love the fact and that you can make this available to other developers. Has that driven a bunch more of innovation outside of Public Health England for third parties leveraging this data as well by downloading them JSON documents?
Well, we hope so, and that's certainly what the data shows us. And certainly when the care home data announcement was made, we saw a huge peak in folks accessing those CSV and JSON files, and certainly the speed with which we've been able to deploy, I guess, how we would describe V1 of the architecture, and the demand that we've seen for people accessing that data has led to us developing on and starting to think about using services like Cosmos DB, so that it's a lot easier to just query that data directly, so that people can continue with that other third-party development work as you describe. So I would hope that lots of the dashboards that people are going to around the UK and perhaps even the world are using these data sets, but we can't obviously be sure about that. But it's certainly a possibility for people to continue to leverage that data.
I love that. A couple of really cool messages there. Surface your data and make it available to others for innovation, and to keep stuff simple, and then you can scale. You can be an architect's dream, right? You don't have to worry about it or get up in the middle of the night.
Yeah, 100%. And I think we've seen some really positive messages in terms of the ability to really quickly do this stuff. Some of the feedback we had was that the architectural achievements were were very rapid. We're talking in days as opposed to what potentially would have taken weeks previously. So we were able to obviously invest resources in supporting the customer to do that, but really help them understand the speed and agility with which we're able to deploy things like this into the Azure platform, as you say, in quite a serverless type environment, which gives the customer a massive opportunity around how they can scale and make changes to the back end environment when they need to, which has been really helpful as the whole situation has evolved.
That's great. Thank you for sharing that, because like Dean said, the simplicity is probably just phenomenal to hear that it is all these things that we use, when we're building our own different things, and to hear that they're being used in this much larger architecture is fantastic. Quick question to Laura here. So thinking about all those different projects you described at the start, what have been some of the key learnings from going through this process, and what's next?
Yeah, I think one of our clear observations is that the adoption of technology over a short period of time has just been incredible. It's been believed that what we've witnessed in the last 2 months would have traditionally taken us over 2 years. And so I hope what we see going forward is that the adoption of technology and the fast decision making for using technology continues. And I hope we build on the baseline so that we can continue to help the healthcare service create the efficiencies, improve patient care, and help them reimagine what healthcare can look like in the UK. I think another interesting insight or learning is that we've overcome some of the cultural barriers that we historically see to technology change. The users necessarily haven't had the ability to resist. They've just had to get on with it. And I think that's helped us be successful in it. And I think it's given a certain element of confidence within the customer base that while change can be challenging and it can be difficult, it can also be a great enabler. And so I think some of our learnings is it can be done quickly. We have to bring the people along, and our baseline now is higher than when we started. And I think our goal is we just continue to build on some of the great technology investments they've made so that we can continue to see the improvements that we're looking for.
And I guess it's awesome to hear, like you said, that the uptake, also that progression of innovation as well. And hopefully we can continue working really closely. I guess one of the interesting bits as well is the teams you've been working with at the National Health Services. There's been a lot of kind of education sharing as well, but we're talking a lot about Learn TV at Build, and that educating developers is so important for us to learn all the new things. Has that kind of been a part of the plan?
Absolutely. Yeah, it is really about enabling and bringing others along. And a big part of our plan isn't just to deploy the technology, but it's how can we ensure that it gets used to its fullest. And so there's been quite a bit of investment on education, on deployment, and making sure that people are leveraging and sharing their insights for the benefit of the greater good.
And Amy, there's nothing that I think a developer loves more than learning by doing. And they've rolled their sleeves up, and we've worked alongside them to solve problems and to deploy some of our most innovative technologies, I think. So that's a great learning experience as well, which hopefully they'll take away from the work we've done in the last few weeks.
Absolutely, learning by doing. So true. They always say, don't you? You do the docs, you do the tutorials, then you build your own project, and all of a sudden you find a million things that you didn't know and you need to go and research. So it's amazing to hear them getting hands-on with that. But huge thank you for your time, Matt and Laura. It's been an absolute pleasure to speak to you about the work you've been doing. For more on Microsoft's response to COVID-19, head to news.microsoft.com. Now to Dean, who's going to talk us through an effort that could soon make systems more secure all around the world. Dean, tell us more.
Thanks, Amy.